na po ba mismo na po?
Meron tayong accredited training centers which can give the necessary training. Meron tayo for acupuncture, meron tayo for naturopathy, meron din tayong for homeopathy, no? Yung acupuncture, libre siya for DOH retained hospitals, for centers for health development, tsaka local government units. Pero meron din tayong mga private, no? Na if they want to have parang diploma or certificate before they practice, meron din tayo accredited training centers. Yung sa hilot naman, meron din tayo sa TESDA, yung Filipino Wellness Hilot Massage. Pero meron din tayong accredited training centers ng PITAHC. Ngayon, mababa pa yung ating budget na ilibre natin yung mga trainings. No? So maybe in the future, mabigyan tayo ng kaukulan na mas malaking budget ng government, will make it available to everybody.
Ilan po ang total, ma'am, ng mabibigyan ng award?
I think there are 14 na mabibigyan ng Seal of Excellence Award. Of course, iisa lang yung gold winner. May silver tsaka bronze yung mga runners-up natin. So, they will be given trophies, certificates of appreciation and participation. At meron din silang cash awards which will be converted to products.
Ano po naging criteria for judging po natin para piliin po sila?
Oo. Yung kaninang minention natin na mga criteria is dapat meron silang accredited modality. Doon sa 10 modalities natin, meron silang trainings, meron silang clinic, no? At meron silang traditional alternative health center dun sa kanilang area, be it an LGU, a Center for Health Development, or a hospital. At meron din silang herbal and community garden, at meron din silang mga pinagawang IEC materials, information, educational materials that they can give out to the public.
Ma'am, brief lang. Ano yung importansya? Bakit kailangan yung mga traditional healers natin ay makapag-rehistro? Bakit kailangan nilang rehistro ang sarili?
Okay, so yung traditional healers natin, as we've said earlier, meron tayong Hilot Congress. Ito, libre to sa kanila. No? Last year, meron tayong almost 100 traditional healers from North and South Cotabato. Yung iba dito, sabi nila, piso na lang yung pamasahe, nasa langit na sila. Ibig sabihin, napakataas ng mga mountainous areas na. Now, we brought them to a hotel, no, for 3 days and 2 nights. We paid for their transportation and we oriented them about yung mga local government laws na baka sila ay ma-under doon, kung paano sila matutulungan at kailangan magparehistro sila para matulungan sila ng PITAHC. So aside from attendance to this Hilot Congress, may training at may bagong kaalaman para matulungan naman sila sa kanilang practice.
Last on my part, yung paggamit naman ng traditional medicines natin, yung mga herbal, of course, may benefits naman yung paggamit ng herbal and western medicine. Pero yung mas ipinopromote natin yung traditional na alternative medicine. Bakit po?
Pinopromote natin yung traditional herbal medicine natin. In fact, PITAHC made the very first in the Philippines, Philippine Herbal Pharmacopeia. Kasi yung pharmacopeia, talaan nyo ng mga listahan ng mga gamot. Previously kasi, meron tayong Philippine Pharmacopeia, ang FDA ang gumagawa. Pero ang laman nun, 80% synthetic, and siguro mga 20% lang yung herbal. Napakarami natin, through research, na find out na mga herbal medicines na mas mabisa pa kaysa synthetic medicines with very less complications to the system and with very less side effects. Gagastusan lang talaga natin ng research so that we can make use of this. And these are even found in our community and herbal garden. So, bakit pa tayo gagastos ng mahal kung pwede naman natin ma-develop at mas available sa atin at mas konti ang ating gagastusin. But it is backed by research so that we can be sure that it can be used safely ng ating community.
Ma'am, marami pong sa mga kabihasnan, lalo sa mga bundok na walang kakayanan talaga magpa-register. Ano ba? Kakasuhan ba agad sila or wawarningan or tutulungan ninyo?
Tutulungan po natin. So, sa mga hilots natin, we have recognition. and certification. Yung recognition, if a community leader can attest na yung kanyang kaalaman ay handled from generation to generation, and then maganda yung practices sa community, they did not defraud the community, wala namang namatay sa practice nila, tutulungan natin. Libre yung recognition, libre yung pag-attend ng ating Hilot Congress, at libre yung pag-training at dagdag na kaalaman sa kanila.
Ma'am, saan po kami makakahingi ng listahan po ng registered medicinal plants po?
Pwede dito sa PITAHC, meron tayong website, oo. At pwede rin nating tignan sa website, sa Director General's page, no? Sa ating Facebook, oo. So doon. And then, we will be putting out the Philippine Herbal Pharmacopoeia one of these days. We had a soft launching last December 22, 2022. Hopefully, we are just waiting for the executive order from the President para gawin itong parang talaan na official ng FDA at ng DOH.
Thanks so much.
Thank you very much.
Good morning, everyone. Today is July 5, 2023, and thank you very much for coming to the Philippine Institute of Traditional and Alternative Healthcare Press Conference. My name is Roderick Domingo, one of the Special Operations Officer 3 of the Social Advocacy and Training Division. Our topic today is DOH PITAHC recognizes traditional and complementary medicine best practices in the Philippines through the PITAHC Seal of Excellence. And to begin, I may present to you the members of the panel. We have our dedicated and hardworking Director General, Dr. Annabel Pabiano de Guzman. We also have Dr. Francis Vicente Esras, Health Education and Promotion Officer 5, and the Division Chief of the Social Advocacy and Training Division. And we also have Ms. Carmencita Castro Santos, the Legal Officer 5 of PITAHC. And we also have Dr. Angelo Ong, the Division Chief of the Research and Development Division, and Attorney Kim Almenie, the Division Chief of the Standards and Accreditation Division. Okay, to start our press conference, may now call our Director General Annabel Pabiano de Guzman to read the press statement.
Morning. Before everything else, I'd like to thank all those who have come this morning. Maraming salamat po sa inyong presensya. This is one of the very first press conferences po ng PITAHC. So kami po ay talagang nagpapasalamat sa inyong pagpunta ngayong umaga. So I'd like to read the press release on July 5, 2023 we're in. DOH PITAHC recognizes traditional and complementary medicine best practices in the Philippines. So the Philippine Institute of Traditional and Alternative Healthcare, yun po yung PITAHC, is an attached agency of the Department of Health. And we are AGOCC and the governing body for traditional and complementary medicine in the Philippines. So PITAHC, or the Philippine Institute of Traditional and Alternative Healthcare, was created through Republic Act number 8423, or the Traditional and Alternative Medicine Act of 1997. So ito yung tinatawag nating TAMA law. So the Institute focuses on research and development. So we have here our division head, Dr. Rodrigo Angelo Ong. Promotion and Advocacy, the division head is Dr. Francis Vicente Ras. And the formulation of standards, guidelines, and codes of ethical practice for the integration of traditional and complementary medicine into the national healthcare delivery systems. And we have our division head, Attorney Ken Almenie. Also, to my left is our Legal Officer 5, Attorney Carmencita Chay Santos. So PITAHC has conceptualized the PITAHC Seal of Excellence, the search for traditional and complementary champions. So this is an award system which is envisioned to promote the highest level of professional standards, inspire excellence, and community service as part of PITAHC's communication plan. So the PITAHC Seal of Excellence Awards, the awards will be on by tomorrow, July 6, at the Seda Vertis Hotel. And the PITAHC Seal of Excellence will recognize the outstanding practices and contributions of our local government units, yung mga LGU natin, the DOH Centers for Health Development, yung CHD natin, and the DOH retained hospitals in raising the profile of traditional and complementary medicine among Filipino health consumers and the society at large. So PITAHC is hoping that through the Seal of Excellence Awards, traditional and complementary medicine will receive the attention that it needs, and with the assistance of our LGUs, local government units, CHDs, our Centers for Health Development, and our DOH retained hospitals, traditional and complementary medicine will be able to complement universal health care, and traditional and complementary medicine will become another option for better health care in the Philippines. So there will be 3 main awards. So we will be presenting the Gold Seal of Excellence, the Silver Seal of Excellence, and the Bronze Seal of Excellence on July 6, that's tomorrow, at the SEDA Vertis North Quezon City Hotel. So the Bronze and the Silver Awards are considered runners-up, and the Gold Seal is the winner. So the winners will receive special design trophies, certificates, and awards in the form of PITAHC products. Maybe later on we can show them the trophies, no? So that it can also be advertised. So the awardees were judged based on their comprehensive efforts to implement RA 8423 or the Traditional and Alternative Medicine Act, its IRR or revised implementing rules and regulations, including PITAHC programs and activities highlighting achievements on P, pioneering and innovative practices, I, information, education, and communication, T, training and education attended by our staff, A, advancement of at least 1 traditional and complementary medicine modality. So we already have 10 traditional and complementary medicine modalities. Of course, pinakauna yung ating Filipino wellness massage or yung ating hilot. Meron din tayong acupuncture, meron din tayong tuina massage, meron din traditional Chinese medicine, meron din tayong Ayurveda, meron din tayong homeopathic and homotoxicology, and then meron din tayong anthroposophic, and then meron din tayong naturopathic, and meron pa tayong chiropractic, no? So chiropractic, siguro alam niyo na yon dahil si Patricia Javier, yung husband niya si Dr. Rob, no, is medyo famous na ngayon. So yun yung mga modalities that are accredited by PITAHC. And then H is for putting up herbal or communal gardens, and C is for community development and services. So we are asking that you help us promote itong ating Seal of Excellence Awards in order to make traditional and complementary medicine another option for better healthcare in the Philippines. So sabi nga nila, the journey of 1,000 miles begins with a single step, and may this awarding ceremony pave the way for the promotion and the advocacy of traditional and complementary medicine. Thank you very much at maraming salamat sa inyong pagpunta. Thank you.
Thank you very much, DG. Now to give you more information about the PITAHC Seal of Excellence, please watch the video. We'll be presenting a short AVP. po. So, we have already heard the statement from the Director General and also the short AVP. Do we have any questions po from the media?
Q&A po, sir.
Yes, okay.
Morning po, sir.
Hello. Cedric Castillo from JNSM. I'm not sure if you use the term challenges kanina po, pero may we know, meron pa bang ano po yung mga challenges na kinakaharap ng traditional medicine vis-a-vis yung how do you say that, established medicine po? Meron ba mga hindrances, meron bang stigma if at all lang?
Yes, thank you very much for that question. So, dati po parang talagang may stigma. Pag sinabi natin traditional medicine, parang quote-unquote quack-quack. So, kaya ito dito sa ating Philippine Institute of Traditional and Complementary Healthcare, we are primarily a research and development institute so that we can prove to the public that scientific po ang ating practice. It is po based on evidences. And for this po, we have also partnered with the biggest number of physicians all over the Philippines, the Philippine Academy of Family Physicians. We signed a MOA just last January 2023. So the MOA says po na we will develop traditional and complementary medicine by incorporating it into the residency training program of the Department of Family and Community Medicine, not only in government hospitals, but in all hospitals with training programs all over the Philippines. So sa Monday and Tuesday, that's July 10 and 11, nandito pa sa PITAHC yung mga chairman and training officers ng mga different training programs. Kasi pag uusapan kung paano ma-integrate natin yung traditional and complementary medicine. So, yung dati pong right shop na napag-usapan natin, together with yung napuntahan mo, Bernie, together with the Department of Family and Community Medicine, they chose po tatlong modalities which they will develop. Number one is acupuncture. Yung acupuncture ay thousands of years old na yan ang practice ng China. But all over the world, parang accepted na nga siya. And it has also been included na rin sa universal health care system ng ibang mga countries. No? And makikita natin na it is also a program na na-incorporate natin sa ating DOH trained hospitals. Yung mga training hospitals natin, sina Dr. Ras, no, together with other medical acupuncturists, he's a medical doctor by the way. Si Dr. Rodrigo Angelom is also a medical doctor. Both of them are acupuncturists. They teach medical acupuncture to our hospitals for the alleviation of pain, no, and very scientific siya because its needles placed along the nerve pathway. So, dapat yung mga nagpa-practice as much as possible, meron din silang background on anatomy, neuroanatomy, and the like, no? And then yung isa pang i-develop natin ay yung naturopathic medicine. Wala namang kontra doon sa medical dahil ang naturopathic ay parang supplementary. The use of herbal and natural supplements, the use of sunshine, air, exercise, so that we could develop our natural immune system. At yung pangatlo naman ay homeopathic medicine. So we have around 40 plus homeopathic practitioners all over the country. And I think 95% of them are also medical doctors. So yung practice naman dito ay like cures like, no? So for example, meron kang sakit, magdi-develop sila ng mga tinctures or medicines na ibibigay doon sa patient para siya ay mag-develop ng kanyang immune system against the disease. So it's also scientific because this is also already backed by evidence-based medicine and this is accepted sa Europe, no? And yung ating king and queen of England, before they are seen by Western trained or allopathic physician, nagpapatingin muna sila sa kanila mga homeopathic physicians. So, that's one of the hurdles that we have already tackled, yung doubt ng medical community about scientific and evidence-based pa itong traditional and complementary medicine. Pero pa rin kami ibang hurdles, and maybe Attorney Chai can talk about the quasi-judicial powers which is needed by PITAHC. Baka matulungan din ninyo kami dito sa aspect na ito. Attorney Chai?
Thank you, ma'am. Good morning. Yes, one of the biggest challenge of PITAHC is the absence of regulatory power of PITAHC. With the increasing number of our traditional and complementary medicine practitioners, it also needs regulation to ensure that the general public, who are the consumers patronizing these different types of modalities, are safe, and the quality of services being provided are effective. So we are pushing for the amendment of our RA 8423 because of the absence of regulation, so that our traditional and complementary medicine practitioners as of now are not being regulated. And we, PITAHC, developed the standards for the practice of this recognized traditional and complementary medicine, but they are not mandatorily required to seek certification or accreditation from us. So we are pushing for the amendment of our RA to ensure that the general public are receiving quality service from our practitioners.
Saan po pwedeng tumakbo ang patient? Huwag ka man sana, in the event na may pangit na mangyari. Saan siya pwedeng tumakbo?
So most likely, they will file a private complaint privately, so that will be civil. So because of the absence, so we could only give our technical expertise in the absence that they are not, since it's not mandatory that they seek certification from us, so we will check if they are in our database, if they have complied the established criteria or standards for certain practice. So we could only, that's the only support we could give to them if their practice are with the standards. So we could just provide technical expertise.
Siguro, Attorney, thank you, Attorney Chan. Attorney Kent Almeni could also add, no? Kasi when they apply, they have to comply with certain standards and regulations, and also guidelines.
So yes po, our division is in charge of accreditation and certification of practitioners. So one of the requirements is the training hours that the practitioner should have before they apply. So in each modality, for instance, acupuncture, they must comply with certain hours. For example, 240 hours of basic health care training and 240 hours basic acupuncture training. So these are theories and actual techniques, and these are provided by our training centers. We have also accredited training centers who cater to students and these trainees. After they graduate, then that's the time they can apply for us for certification. So training is just part of the requirements. So we have also forms, you have to fill out the forms, and of course my fees, certification fees, pero minimal lang naman sinisingil namin. And some requirements, health certificate, because they should be fit, also when they provide healthcare services. So that's part of the requirement. And as to your question on the liability, siguro kasi they are not yet, as mentioned, they are not yet regulated. Itong mga practitioners, they will be judged on the basis of our civil code, yung quasi-daily negligence, for instance. They practice, then they injure someone. So yung sa civil code, so doon sila i-evaluate yung nila. If they if the cause of the injury was really negligence on their part because they did not follow the procedure. Ayun lang po.
Thank you, Attorney Ken. In order to professionalize their practice, they are also required to undergo continuing education units. So every 3 years, in order to comply with their certification, they have to come up with certain number of units. I think 30 units, so that they can be recertified with PITAHC. So sa local government orientation, which standards and regulation conducts, we talk to the RLED, to the regulatory local development of our centers for health development, and they tell them that as much as possible, kung pwede, huwag mag-release ng business permit dun sa ating mga centers of training at dun sa ating mga clinics unless they have a certified practitioner, merong parang karatula na may certified practitioner, merong certification signed by the Director General, yours truly, at meron din silang nakalagay na certified training center or accredited clinic. No? So yun ang ating pag-regulate sa kanila. So this is conducted all around the Philippines, attorney, right? Itong local government orientation. And so far, sumusunod naman yung mga local governments, hindi sila nabibigyan ng business permit unless the practitioner is certified with PITAHC and the practice, the training center or the clinic is accredited also with PITAHC.
Last of my part po, ma'am. Ma'am, kamusta po ang status noong pag-incorporate sa Universal Healthcare Law? Meron na po bang practice or modality na included na dyan sa, in terms of yung coverage?
So I'll give the microphone to Dr. Rodrigo Aguilar because we already developed clinical practice guidelines for acupuncture and we already submitted into the Health Technology Assessment Unit of the DOH para maisama sa ating Universal Healthcare Law.
Yes, good morning. Last year, we completed our study on the clinical practice guidelines for acupuncture for 2 indications. So, acupuncture for low back pain and acupuncture for chronic migraine. And the study concluded that these are indeed safe and effective. Acupuncture is safe and effective against these 2 indications. However, we were advised to add more evidence. Therefore, for the next coming years, we will be continuing our research to expand our CPGs and to expand also our search for evidence to support the local industry of acupuncture, so that it can be included once and for all into the universal health.
So wala pa po? Wala pa covered kahit anong practice?
Wala pa. So, but we are in the works of by the age now, prior to its nomination into the universal health.
Yes, in addition, yes, we are still in the process of integrating as a start in different DOH retained hospital. We have already established a Traditional and Complementary Medicine Center where they offer mostly one acupuncture. So we have already several TAC centers in different DOH retained hospitals.
Para libre sa amin acupuncture na.
Okay, so Dr. Ras will talk about the TAC centers, itong traditional alternative health care centers sa different DOH hospitals. Ito din yung isang parang criteria natin for the awarding of the Seal of Excellence. Pero dito sa Manila, meron tayong libreng acupuncture sa Jose Abad Santos Memorial Hospital. In-inaugurate yan ni Mayor Lacuna at ni Vice Mayor Yul Nieto. Oo. So, Sir Yul Servo, they inaugurated that. At free doon yung acupuncture, acupressure, tuina massage, fascia, and moxibustion. Okay, so Dr. Ras will tell you more about the traditional alternative healthcare centers.
Yeah, the Social Advocacy and Training Division of PITAHC, we conduct basic and advanced acupuncture training sa ating CHDs or the Center for Health Development, and at the same time sa ating DOH retained hospitals. So we offer this for medical doctors and at the same time allied health professionals coming from the hospitals. So like for example, physical therapists, nurses. So then after that, we have a memorandum of understanding with the hospital in establishing a PITAHC center, wherein after they have signed the MOA and established their PITAHC center, so we offer them as a starter kit, like for example the acupuncture needles. We supply them these acupuncture needles, and at the same